Senator Bernie Sanders.
Since President Trump was elected, these gentlemen and the Republican leadership have on 5 occasions tried to repeal the Affordable Care Act, throw tens and tens of millions of Americans off of the health insurance they currently have, and make it impossible or very difficult for people with pre-existing conditions to get the health care that they can afford. What these guys want to do is force older workers to see a very significant increase in their premiums, which is why the AARP is vigorously opposed to their legislation. They want to tell 2.5 million women in the United States of America who today choose Planned Parenthood to get the health care. They can't do that because they want to defund Planned Parenthood. But here is the most important point. We're going to have a debate. It'll be a good debate. We like each other. But, yeah, we really do. But here's the point. Every major health organization in this country, whether it is the American Medical Association, the American Hospital Association, the American Cancer Society, the Alzheimer's Society, every single major medical organization in this country thinks that their proposal is a disaster. So our job now is to defeat this disastrous proposal, get back to the drawing board, see if we can work together for some short-term fixes. Long-term, in my view, I speak only for myself, this country has got to join the rest of the industrialized world, guarantee health care as a right of all people.
Okay, Senator, thank you. Senator Cassidy.
Let me just not give you my view. Let me tell you what the American Medical Association says. It says, quote, "This bill will cause patients and consumers to lose important protections as well as undermine safeguards for those with pre-existing conditions," end of quote. So what will happen is, yeah, insurance companies will not be able to deny you health insurance if you have a pre-existing condition, but they can charge you anything you want, which for all intent and purposes, for most people, will mean that they're not going to get that insurance.
Senator, and by the way, this is why the Republican governor of Ohio opposes this proposal.
Senator Cassidy.
Just shake it like a piggy bank, and all the drugs would come out, and it still wouldn't be enough for us all. There are ways to address this.
I'm the authority on Canada. I can see Canada from my porch. Okay? And I can tell you this, that the drug prices in Canada are half what they are in our country. And that's why Bernie's been involved in this. Lindsey's good friend, my good friend, Senator McCain, has a bill with me that would allow for this reimportation to bring in less expensive drugs. It has strong bipartisan support. Senator Collins is supportive of this bill. So that's what we'd like to work on. Things like that, the Medicare Part D negotiation. I worked in the private sector. I'm no socialist, okay? And what I want to see is more competition. That's what this is about. By either having competition with generic companies and stopping them from paying each other off, or having competition with drugs from other countries, because that is the only way we're going to bring these prices down right now. 4 out of 10 of the top 10 selling drugs in America have gone up over 100% in just the last few years. Insulin up 3 times. Naloxone up over 100%. That's a drug that you use for opioid overdoses. This epidemic that's sweeping our country, and they have the gall to increase the prices of that drug like that. We have to take on the pharmaceutical companies strong.
Senator Graham.
You go to private hospitals. So let's call it what it is. It's a Canadian system. It is not a British system. And I know that you know the difference. All right. And last point, the point that Senator McCain made, that Amy just talked about. What he said is, in so many words, how could anybody support a process where you're dealing with 1/6 of the American economy? You had one hearing today. We still don't have a full CBO report. You changed the bill 3 times in the last day. No sane person thinks that this is a process to deal with one of the major issues facing this country. That is what McCain was talking about, and he's absolutely right.
Senator Cassidy.
Heard that too, about the premiums, and there's a reason, and that is that we passed a bill, as Bernie explained. It did some good things, but you don't pass a big bill like that and never able to improve it or change it. And what Senator Cassidy just told you, I think that's a false choice. It's not just between one or the other. There is a middle ground here of things we can do to fix it. I've mentioned the pharmaceutical prices and actually taking that issue on. It's nearly 20% when you count hospital pharmaceuticals of the healthcare costs. We need to take that on. We can't just let it sit. The ideas that I brought up that actually are on the table now. The effort was almost there, and it was just stymied because this bill took up all the oxygen this week. They're ready to go back and pass something, and there's a lot of people, Democrats and Republicans, that want to make these changes and help the states. And then the third thing I'd say is I've heard a lot from small business people. There's more we can do there, too. Tax credit. There's a tax credit right now that you can only take for 2 years for small businesses. Let's make it permanent. Senator Stabenow has a bill to do that, and it would really help a lot of our small businesses to pay their employees health care.
Senator, all told, federal spending on Medicaid would be reduced by about $1 trillion over the 2017-2026 period under the legislation, and the program would cover millions fewer enrollees. What that means in terms of what you raised, question you raised, we got a real issue in New Hampshire, we got one in Vermont. This is a national tragedy. When you cut back on Medicaid and you don't get money to the states for prevention and for treatment, there is nobody who doubts but that a lot more people are going to die and not get the care that they need. So if we are concerned about the opioid epidemic, the idea of cutting $1 trillion from Medicaid, which is one of the major sources of funding at a local level to deal with the opioid epidemic, is absolutely crazy.
Thank you, Senator. I want to stay on the issue of Medicaid, but not Medicaid expansion.
Well, let's reiterate what the CBO just said. $1 trillion in cuts. Let me finish. $1 trillion in cuts to Medicaid. Now, this is preliminary because you keep changing the plan every day, and CBO has not had the time to do the kind of thorough study that the American people want us to do. But there have been numerous studies out there that suggest that your plan will throw over 30 million people off of the health insurance they currently have. And let's once again, from a human point of view, we've heard some of that discussion tonight, understand what it means when people who are struggling with cancer, heart disease, diabetes, suddenly get the word that that legislation passed and they lose the health insurance they have. That is their lifeline for literally staying alive. Our job as a humane society is to do a couple of things. It's not to throw 30 million people off of health insurance. It's to do what every other major country on earth does, guarantee health care to all people as a right. That's what we should be doing. And second of all, what we have got to be doing is come up with short-term solutions. And I think Amy mentioned some of them. Why don't we make sure that in every state in this country there is a public option, a strong set of benefits at an affordable cost to compete with private insurance? I think that's a very, very good idea. Some want to do it through a Medicare option, some want to do it through a Medicare option. But people should have the option to go beyond the private insurance company in their own community. I think that would be a successful effort, and I would hope that you would support us on that.
Let's cut through the